Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, new federal rule to strengthen non-discrimination protections, advance civil rights in healthcare. The Department of Health and Human Services issued a final rule on Friday to safeguard individuals, particularly from the LGBTQ community, against healthcare discrimination. The rule, under Section 1557 of the Affordable Care Act, prohibits discrimination based on gender identity and sexual orientation, among other factors, in healthcare settings receiving federal funding, highlighting the significance for older LGBTQ individuals fearing discrimination in LTC facilities. Advocacy groups like the LTC Equality Index and Justice in Aging praised the rule's restoration of crucial anti-discrimination protections. This is a commendable move, emphasizing the importance of inclusive care amid evolving healthcare technologies. The Health and Human Services Secretary affirmed the agency's commitment to combating discrimination, promoting equity, and protecting patients' rights. Why legislation for nursing home agency labor must focus on pricing, consider state and finalized federal staffing rules. In New York and Pennsylvania, modifications to staffing mandates in nursing homes are being met with mixed reactions. While intended to reduce reliance on costly staffing agencies, operators expressed dissatisfaction due to ongoing workforce shortages and geographic challenges, and the need for changes in pricing and worker classifications. It must be emphasized that agencies play a critical role despite high costs, underscoring the industry's dependency and stressing the push for classification and challenges of meeting increased staffing requirements, especially with fines looming for noncompliance. Both states face evolving staffing standards, with New York nursing homes particularly burdened by financial strain and limited support despite federal regulations. The debate centers on balancing financial sustainability, quality care, and regulatory compliance amid workforce crises and geographical disparities. Next, database indicates regions with biggest staffing challenges. A recent analysis of summer 2023 CMS data by USA Today indicates only slightly over 1% of U.S. SNFs consistently meet the new federal staffing rules requirements. The analysis highlighted regional discrepancies, particularly in southern states like Louisiana and Texas, which struggled with meeting the RN and CNA hourly requirements. Providers expressed concerns over the new 24/7 on-site RN mandate, anticipating challenges in compliance. In response, CMS announced a $75 million recruitment program and potential partnerships with states to facilitate transition to the new standards, which are set to phase in over 5 years. This comes amid provider dismay over the lack of funding for nursing homes and workforce initiatives. The analysis underscores ongoing challenges for SNFs as they work towards meeting updated staffing standards. Bill to block the staffing rule, LTC measures to headline congressional hearing. The Protecting Seniors Access to Care Act, a bill aimed at challenging the federal nursing home staffing mandate, is set for review by the House Energy and Commerce Committee on Tuesday at 10 a.m. This legislation seeks to prevent CMS from enforcing its new minimum staffing requirements, including the 3.48 hours of direct care per patient per day and 24-hour on-site RN rule. While the facility assessment update requirement begins on August 10th, staffing provisions will be phased over the next 2 to 5 years. Providers facing challenges complying with mandates without additional funding are pushing for legislative solutions. The proposed bill garnered interest from stakeholders, including AHCA, which advocates for stopping the unfunded, unrealistic staffing mandate. Simultaneously, other bills addressing workforce solutions, such as the Building America's Healthcare Workforce Act bill and Ensuring Seniors Access to Quality Care Act, will also be discussed. The Congressional Review Act is being considered a potential legislative strategy to challenge the mandates. And last, post-acute care QRPs, SNF provider preview reports are now available. SNF provider preview reports have been updated and are now accessible, featuring performance scores for QM. These scores will be published on the Care Compare and Provider Data Catalog during the July 2024 refresh. The data spans from Quarter 4, 2022 through Q3 2023, with CDC measures covering influenza and COVID-19 vaccination coverage among healthcare professionals. Claims-based measures will display data from Q4 2020 through Q3 2022, while SNF HAI measured data covers Q3 2021 through Q3 2022. Providers have until May 15, 2024 to review their performance data. Only updates and corrections made before the final data submission deadline will be reflected in publicly reported data on CareCompare. Any updates made after the deadline will only be reflected in specific reports, not on CareCompare or provider preview reports. Providers can request CMS review during the preview period if they find inaccuracies in their QM scores. For questions related to accessing provider preview reports, please reach out to iKeys Service Center email ikeys@cms.hhs.gov or call 1-800-339-9313. For questions about SNF QRP public reporting, email snifqrppr questions@cms.hhs.gov. Thanks for joining me for News This Week in Nursing Homes. For more QSource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all your QI needs, call the Q.